the maxillary artery. And that's best seen on this skull model here. So here would be the external carotid with the vertebral artery running up through the transverse foramina of the cervical vertebrae. We pull this down. You can see the maxillary artery, and here would be the occipital. Facial is missing, but would be superficial to the mandible. Right? Now, I said there was a branch from maxillary that passes up through the skull. So here is the foramen ovale, and just behind it is foramen spinosum. So this vessel coming through and supplying the periosteum and the if you look up circulatory wire model, and some of them will be labeled. Unfortunately, with Veterans Day on Friday, the open lab will be closed. Okay. Jeff Shangaris, that teaches the Monday, Wednesday section of Bio 22, also runs open labs in American River. He had one last night to make up for, because he's open on Fridays as well in the late afternoon. I think he's doing another session Monday night of next week, so I'll put an announcement up on D2L on Blackboard. He is normally open on Wednesday nights, and he'll be open from 7 to 9 tomorrow night. Okay, it's really, you know, the American River College science is in the upper northeast corner, and it's room 418. You can just look online for a map for that. All right. So we have these wire models. It tends to be a little tight in here where the organs are. So here we would have the subclavian where all these branches are coming off is going to be axillary. Then we have brachial. And I would tag brachial probably just above where it branches for radial and ulnar, so you're not confused about, okay, where do we change from brachial, axillary to brachial. Then we have the medial radial and the lateral, the medial ulnar and the lateral radial, superficial, and the posterior one is going to be deep palmar arch. Okay. Some of them times they make them with 3 arches, which don't exist. If I do it that way, I would ignore the middle one and just go the more anterior, the more posterior. Okay. On this one, you can also see the branch of subclavian, which is internal thoracic, giving off anterior intercostals, and from the back of the aorta, the posterior intercostals. Okay. Another view of the internal thoracic is from this breastplate here. So in the back, remember I said it was just lateral to the sternum instead of 18 inches apart like I drew it on the lecture. So here on the deep surface would be the internal thoracic artery on either side of the sternum, giving rise to anterior intercostals. Okay. If I tag posterior intercostals, they will be where you can see them coming off the posterior surface of the aorta. Alrighty? So over about me, the hand model here. So we take off the palmar aponeurosis. You can see right here is the superficial palmar arch, but it's fatter on the levator side because this is the ulnar artery. Over here is the radial artery, and it pierces through this web space. And if we take this off, we have the more proximal deep palmar arch. Okay, you can see it on those components as well. All right, now for the branches of the aorta. The first one is the inferior phrenic. Okay, best view for inferior phrenic is on the torsos. In the back, where you can actually see the artery on the diaphragm. Also, those are good for the suprarenal arteries, superior, middle, inferior, adrenal, or suprarenal. In addition to the torsos, one of the better components are these charts, especially where you can see the organs over here. You don't just have vessels sticking out in space, you can see them related to structures. So diaphragm's going to be here. Here's the celiac trunk, and you have the gastric associated with the stomach, the splenic, obviously going over to the spleen, and the hepatic going over to the liver. All right. Then the superior mesenteric down here has been cut where it goes to the small intestine, but you can see that it's going to the ascending and transverse parts of the large intestine. Here would be the inferior mesenteric with the left colic and superior rectum. Okay. But you can't see gonadal on those. On this model, celiac trunk is rather short. You can see a little bit of left gastric, definitely splenic. So that's pretty clear to pick up because it's going over to the spleen. And hepatic going over to the liver. down there, going behind the stomach, and coming over the small intestine. So that's superior mesentery. And that's about the clearest of any of our charts or models. All right, we have the kidneys. So those are going to have their renal arteries, and again, the torsos are best for the adrenals. And here would be the gonads. Right? Again, if we don't know if it's male or female, let's call it gonad. Otherwise, it's ovarian or testicular. going to disappear into the adductor magnus muscle. And we won't see it again until we get to the posterior aspect of the thigh. Now it has a different name. So the back of the knee is called the popliteal artery, or if you prefer, popliteal. So over here, and again I have this redrawn behind the chart. I'll pull the chart up a bit. So here the dotted line is showing it's disappearing, or looking through the lower extremity to see it. So we have femoral artery, and here is popliteal. There are several branches that wrap around the knee called genicular arteries. Remember, genu means bend. When you bend your knee, genuflect. So these are genicular arteries. So those are seen right here, above and below the knee. The popliteal artery ends, and it's kind of difficult to see here, so I'll show it to you on the wire model. So all of this is popliteal until it gives off the anterior tibial. The rest of this, going down the back of the leg, is all posterior tibial. Okay? So we'll come back to this in a sec. So we give off the anterior tibial, and all the rest going down the back of the leg is posterior tibial. So popliteal is going to end by dividing into anterior and posterior tibial. Okay? Anterior tibial passes between the tibia and the fibula. So we see it here with the deep fibular nerve. So this is anterior tibial on the front. On the back is posterior tibial. Anterior tibial comes onto the top of the foot and becomes the dorsalis pedis, which means top of the foot. All right? So on the top of the foot becomes dorsalis pedis. Posterior tibial has one more branch called the, well, three. One called the fibular artery, because it's supplying the lateral compartment of the leg. And then on the bottom of the foot, as you'll see on the behind the screen, what's the bottom of the foot called? The palm for the hand. The bottom of the foot is another P word, plantar. So the tibial finally ends, posterior tibial finally ends by giving off a branch to the big toe. And that's called the medial plantar. And a branch to the little toe, called the, big surprise, lateral plantar. Okay? So before I pull it, well, I can do it now, but I'm not going to use that. So I've kind of taken the leg and drawn it a little bit larger. So here's popliteal, ending by forming a posterior tibial and anterior tibial. Posterior tibial gets off the fibular, which supplies the fibularis brevis and longus. And finally, posterior tibial ends by forming medial plantar and lateral plantar. And anterior tibial ends by forming dorsalis pedis on the top of the foot. So over on the charts, we don't have any models that show the bottom of the foot very well, except for these wire models. So the left, you can see in the back there, the left lower extremity is up on a block of clear glass. And on the bottom is a mirror, reflecting the bottom of the foot. So that's where I would typically tag medial or lateral plantar, okay, or dorsalis pedis. So here we have the femoral artery. Now it's going to change to popliteal, but we don't have the adductor magnus to show where that change occurs. So I would probably, if I want popliteal, I'm going to tag it right above where anterior tibial and posterior tibial divide. Okay? Now how do I know which of these is anterior tibial and which is posterior tibial? Posterior tibial has a lateral branch. Anterior tibial does not. Okay? So this is anterior tibial, this is posterior tibial, and the fibular artery is a branch of posterior tibial. Okay? Alrighty.